Well, thanks everybody for coming. We've had a big day. We were over at the White House, but we thought we'd do this here also just so you get a chance to ask some questions about what we're doing. For the last several months, I've been working with the Trump administration on this idea of health associations. It's not really a new idea. It's not really even my idea. Senator Enzi had the bill back in 2006. I think never got to a vote, but he's been pushing it since then. I think even back into the 90s, people have been in favor of this. Really, this isn't something brand new. So those who are saying, oh gosh, what will happen and bad things could happen from this is exactly what happens in half of the insurance market. Half of the insurance market today, if you buy private insurance in this country, is large group ERISA self-insured plans. So over half the people in our country already have this, but they work for big corporations. The idea with the president's order today is to let individuals get what basically other people have by working in big corporations. We think that this holds great potential. There's 28 million people in our country right now who don't have insurance, even with Obamacare. We want to find out how can you get less expensive insurance so some of those 28 million could buy insurance. There's also 11 million people in the individual market who I think are terrified of what they have. They buy insurance on their own. So if you're a plumber or a welder, an accountant, maybe a doctor's office, it's a small office, or an accountant's office, lawyer, you're buying for your family. If some of your family, one of your employees gets sick, if one person out of 5 gets leukemia, you got a real problem. It tips the balances against you. So what we want is to let those people join a group. Let them join a bigger group so they can have the leverage of market size and then be able to bid prices down. Some on the other side have argued, well, they just get crummy insurance. It's going to be bare bones insurance. And most of the media that has a bias written into their stories have been writing that bias. It's going to be crappy insurance. And I say, well, go talk to any of the people who have large group ERISA plans now and ask them if they like their insurance or not. Most of the big corporations have this. This is what most people who work for themselves would like to have. So I think instead of it being the least common denominator, you may actually get something better than you imagine. We have never, ever had a healthcare organization or association with millions of people in it. The largest corporation in our country probably is less than 1 million people. What happens when you let the National Restaurant Association or the International Franchise Association, what happens when you let them pool together and you have millions of people and have one person that negotiates with the insurance companies? I think you might get tremendous leverage. You might get, instead of just bare bones, you might say, I've got 10 million people, I want pregnancy coverage. I want dental coverage. There might be, I want vision coverage. All of this comes from leverage. And I think there's a possibility you get something much better than you ever imagined. But I think what we have now is not working. Prices have doubled the individual market. It's just frankly not a good place. And neither side has an answer. Both sides just want to subsidize the individual market. They're not willing to fix it. This fixes it. How does it fix it? Lets you get the hell out of the individual market and get into the group market. With that, I'd like to introduce Kelley Sun, who is the president of the International Franchise Association, and she also has somebody from her association that she can introduce and maybe tell you a little bit how it might be from their perspective. Kelley?
Thank you. We see this as a major step forward. I'm Kelley Sun. I'm the CEO and founder of Bright Star Care. We help grandmas and grandpas stay at home so they don't have to go into a nursing home. We have 300 locations across the country, so we're a franchise system. I also am honored to be the chairwoman of the International Franchise Association. This is an issue we've been working very diligently on because right now we do feel like there is a disadvantage in negotiation, being able to get the same pricing and the same access to benefits that large businesses and unionized employees have been able to have for decades. And this is a step in the right direction. I think employers desire to provide great insurance and be able to provide great benefits to retain great workers, and this is a step to allow us to do that. As a franchisor, it is something that I'm very much interested in providing to my franchisees where it's cost effective so we can put more people to work and offer them benefits so they want to stay with our system. But we need a mechanism like this to be able to allow us to have the same access and rights as large businesses have had before. I have Rima Lul with me, who is...
Kelley, could you also tell us, are you thinking about this? Is this a possibility you might form?
I think both. It is absolutely something that the International Franchise Association, in anticipation of this, is looking at doing and offering to the 733,000 establishments that the International Franchise Association represents, and over 6.5 million employees that are employed by those establishments throughout the country. It's a large segment of the population, and where jobs are created, 2/3 of jobs are typically in a franchise business in terms of new jobs created each year. As a franchisor, we are also every day trying to help improve profitability for our franchisees. Anything that we can do to help them access more workers and put them to work helps grow their businesses. Anything we can do to help them cut costs by having better negotiation power with health insurance helps our businesses be more profitable. And we've been unable to do that because these steps hadn't been taken before. We're grateful to have these steps taken. Reem, who's one of my best franchisees, I'll let her speak, but has been unable to afford health insurance for her employees to be able to make that available, and this changes that.
Hey everybody, my name is Reem. I'm a small business owner just across the river here in Arlington, Virginia. We've been in business for 4 years. There's just 5 of us in my office and a few dozen caregivers and nurses in the field, helping our clients stay home safely and comfortably. And I come from, before this business, I come from corporate America. I worked for a Fortune 500 company, so the idea of not being able to afford insurance for my employees is embarrassing, is just wrong. Living here, not being able to attract the best people and honestly treat them like they need to be treated, giving them the benefits that they need and giving them the health insurance and other benefits, and we're not able to afford that. So being able to collaborate, negotiate, be part of a group of businesses, small businesses across the country who would work together to be able to afford that is an amazing idea to me.
Congratulations.
Thank you. You can stay up there if you want. Any questions that anybody would have? Yes.
So experts say that under these plans, premiums for healthy Americans could go down, but because they might be leading the exchanges, premiums for sicker Americans could skyrocket. How do you justify that?
The health association plans won't discriminate. So if you are sick and you're in the individual market and you have leukemia, you can become part of an association plan tomorrow. They can't discriminate, and they won't discriminate on pre-existing conditions. All group insurance in our country since 1996 has said you can't. And so even before Obamacare, you cannot get group insurance under ERISA if you discriminate. So the same rules that apply to big corporations that are out there are going to apply to this as well. We also think that most of the complaints about people who say, oh, you're going to get adverse selection, you're going to get the non-smoking triathletes are all going to join and you're not going to take any of the unhealthy people, they've never seen what we're talking about. States have had health associations in the past, but they've been small. We're not talking about 100 people. We're not talking about 200 people. You can still have that skewing effect with small groups. We're talking about groups of 1 million people. The International Franchise Association is at 700,000 members and 7 million employees. You know, what if only 20% of those, what if you only had 1 million? That's still an enormous group. That's bigger than any corporation. They will not discriminate on health. And so the thing is, there's amazing things. And the people who are the naysayers on this, they need to say what they love about what we've got. What we've got is an individual market where it's gone up 100% and small business owners can't get insurance. We're trying to give people something good. If there's a rare person that is left, see, I want nobody left in the individual market. I want everybody in the individual market to be in the group market. I've yet to meet an individual. Have you ever met someone who works for themselves who says, oh yeah, I really don't want to have Toyota's insurance or General Motors? That's what people want. We are giving people today, if this works, every individual a chance to get the hell out of the individual market. This means less subsidies for the individual market. This means the individual will get group insurance. There always is going to be this swirling question of adverse selection, but there is not going to be any ability of these groups to only take who they want. The main thing that's going to happen is you're going to get enormous leverage of size to get cheaper prices.
2 questions, if you don't mind. There's a lot of discretion left to the agencies in the executive order, at least kind of how I read it. What assurances do you have that the administration will actually go as far during the rulemaking process as you're looking for? And then second, a lot of people reading through it believe that it could be subject to legal challenge on ERISA grounds. And as your office has been working on this, feels like you found a way forward on that.
We've read the original law, and we think the original law allows for much more expansive understanding of what an association is. Interestingly, we're not talking about creating something by executive order. The First Amendment says you have the right to peaceably assemble, and the Supreme Court has said that that means the right to assemble and associate with people for economic purposes. I think NAACP versus Alabama reinforced the privacy nature of your group and that you can freely associate. It's a basic right. And I think it was U.S. Roberts versus U.S. JCs that says you can associate for economic interest. So we think there's a fundamental right here, and that the people interpreting ERISA in the past, not the law, but the people interpreting it, narrowly interpret it. I have no assurance as to what will happen. I just have to trust that President Trump wants them to reevaluate this, and I think the way rules are written, they can't prejudge it either. They're supposed to look at it objectively and try to say, what did the law say? What have regulators say? It is our belief in our office, having read the original law and looking at what regulators have done, is that they severely limited themselves, and we think too much so. And we think it would be great. This is allowing people the freedom to associate. How could there's something so American about it? I don't know. People can quibble and say it will work or won't work, but there's something fundamentally American about letting people join together to try to have purchasing power. Yes.
Administration officials have said that it's not clear whether a self-employed individual would be able to join an association health plan without customer rulemaking. So is that the same thing, like why you're confident that they would be able to do that?
I think it's unknown, and that's why we're also pushing forward with legislation. I have legislation, if I had my way, if you joined Costco, there are 85 million members of Costco, I'd let Costco negotiate for you. They seem to be pretty darn good at negotiating lower prices. I'd let Walmart do it. I'd let any group you wanted. I want to disrupt the system. The current system, big insurance has all the power. And the little guy or the little woman in a small business has no power. We've got to equalize the equation. We don't have to tear up or tear down the insurance companies, but we should empower the consumer to join. This is basically collective bargaining for consumers. There's something fundamentally American about letting people join together in a group to try to negotiate better prices. We need to balance the equation. The insurance companies went from $5 billion a year profit before Obamacare to $15 billion a year. They're making plenty of money, and I don't begrudge them the money, but it annoys the hell out of me that they're up here with their hands out saying, oh, we're not going to sell any insurance in the individual market unless you give us more money, more of the taxpayer money. That's not capitalism. That's you up here begging for handouts from the taxpayer. And I don't want to try to keep putting a subsidy Band-Aid on this. I want to let people get out of the individual market. There is no reason why we should really have an individual market. It's a historical aberration of the tax code. When we associated employment and insurance together after World War II, right around that time, we created an individual market. Why should you be punished for working for a small business and rewarded for a big? And why should small businesses not be able to get together, come together to negotiate? So I think there's a great deal of opportunity here, and I see nothing but upside from this. The other thing is we'll see over time. Maybe extraordinarily big, or maybe more things that we can do to even encourage it to be bigger. Yes?
Does the signing of the order today make you likelier to vote yes if the Senate revisits ACA repeal next year?
I've always been for repeal, and every real repeal that's come down the pike, I've voted for. I have not been for replacement that involves trillions of dollars of spending because we frankly are broke. So I'm always inclined to vote for repeal. This today I would consider to be part of replacement. And I thought we agreed on repeal as Republicans. Turns out we didn't completely agree on repeal, but we certainly didn't agree on what replacement meant. For me, replacement meant more freedom of choice, less government. It never involved sort of a federal program. It involved getting out of the way to let people choose to buy what they want. And as much as people say, oh, won't it be terrible if people could buy a catastrophic policy? No, if you're 21 or 22, it might be what you want. You say, oh, that would cause adverse selection. It's like, what's freedom? Do you want freedom or you don't want freedom? You want to let people buy what they want? We don't command you to buy anything else. Why would we command you to buy insurance? And what kind you have to get? There fundamentally are people who are not yet ready to have children, who don't want pregnancy coverage. And if you make $30,000 a year, isn't it a wiser decision to let you buy cheaper insurance if you decide not to have children yet? Or what if you're 75 years old and you're not going to have children? Isn't it not your fundamental right to decide whether to buy insurance or not? And so really we have to let people do what they want to do. And that's what we do in most of the rest of the marketplace. We allow people freedom of choice.
So is that a no?
I'm for repeal. It depends on what the bill is. I mean, I am for repeal and will continue to vote for repeal. But in the meantime, see, here's what I suggested to him last time when we came to an impasse. I would have just put the HSA reform forward and maybe some waivers for governors. It wouldn't have been the whole repeal, but we'd have gotten something done. Somebody needs to kind of try to focus our energy towards something good. This is something good today. Expanding health associations. Had we just simply expanded health savings accounts, we'd have done 2 good things in a month, and I think we'd be sitting in a much better position. Instead, we got nothing because no one seems to be able to figure out how to corral everybody together in a common territory. But I am for repeal, and I'll vote for repeal, but it depends on what the repeal is. Yes?
So some Democratic AGs, including Javier Becerra in California,
I'm not echoing yours hard for me.
there could be some legal challenges to this executive order. And I was wondering what your level of concern is that if there are going to be roadblocks in actually implementing this, and whether you think Congress should have some type of legislative fix to ensure it happens.
I think in our country you always sue when you don't like something, so somebody's going to sue, I'm sure. And if I had to guess, it would be a Democrat attorney general from a blue state, you know. And we've looked at the original law, though, and we think that the law allows for much more than has occurred in the past. So we think there is a great deal of freedom within the law to allow for associations, and we'll just have to see over time. But I think the people who do sue will have to explain to their voters why they're suing to prevent you from having a choice in what kind of insurance you can buy and to try to prevent you from buying inexpensive insurance. I think that's going to be a difficult explanation for voters. And really, there's nothing fundamentally Republican or Democrat about it. This is collective bargaining for consumers. This is a co-op. This is a purchasing pool. This is something that I've probably mentioned this to 20 Democrat senators in the last 6 months here. Not one of them says, oh, that's a terrible idea. The problem is we've been at each other's throats over repeal, that no Democrats wanted to sign on to anything because they don't want repeal. So this is outside of repeal. This is, I think, could be bipartisan replacement. And really, I see no reason why we couldn't get Democrats in favor of this if we don't make it about Obamacare so much. Yes?
Two questions, if you don't mind. First, I wonder if you could tell us if there's any sort of timetable for when we might start to see these changes implemented. And second, I wonder if you could talk about how this order today is going to impact those bipartisan efforts that your colleagues were engaging in to sort of stabilize the current Obamacare markets.
I think the timetable, unfortunately, takes a while. Most people now are in the process in the next couple of months of buying their insurance for next year. And so, you know, you're already looking at people buying 2018. It's going to take a couple of months, my understanding, to finalize these regulations. They've got to go through a process. I think they're looking at realistically 2019. But it's not an argument against doing something. It just means that it takes a while. The gears of government grind slowly. And the second question was...
how this will impact the bipartisan efforts.
I don't know that it necessarily does anything to the bipartisan efforts. I've been a critic of the idea of just subsidizing the individual market. And I've tried to tell both Republican and Democrat colleagues that if you subsidize something that's broken, it doesn't fix it. So, for example, we're giving cost-sharing subsidies to try to bring down the price for people in the individual market. Well, if the price curve goes like this, and that's what it's doing, you can give people more money and it's less bad, but what have you done to the curve? Giving subsidies to rising prices doesn't make the curve change. It's just you give people more money as the price goes up. So the individual market premiums have doubled under Obamacare, and we give people money to help them pay for it. But a lot of people get a plan that has a $6,000 deductible. If you make $30,000 a year and have a $6,000 deductible, and we've got to buy the whole thing for you, I'm just not so sure that that's a winning solution. So I really haven't been in favor of that's been part of the bipartisan thing. The other part of it was more waivers for states, which I'm in favor of, but probably not if it means adding more subsidies to the individual market. See, I don't want to subsidize the individual market. I want to let people get the hell out of the individual market into the group market, and then nobody would subsidize them. Through their buying power, they'd get something less expensive, and really, if anybody subsidizes them, it'd come out of the profit of the insurance companies, not by mandate, but just, I think that'd be the net result.
I think we have time for one more.
All right. Thanks, everybody. Hey, thank y'all.